Right, so if you ask medical students and doctors what questions they have when it comes to residency training, it will be something like, when should I proceed to residency training? How do I choose which one to pursue? Or where's the best hospital to do training? And those are the three things that we're gonna explore in this video, so let's get into it. Now, part one is, where should I proceed to residency training? Now, the answer to this question is quite simple, and it all depends on your life goals and your timeline. There are several things to consider when you answer this question. One of them is your life goals. Say, for example, that your life goal is to finish residency so you can immediately establish your practice in your hometown and maybe start a family by age X. So in that case, it means that you would have to start residency right away after passing the board exam. Or maybe you just want to take some time off after long years of studying in medical school to pursue some of your non-medical passions and hobbies, and that's also okay. And this period of time between the end of your board exam and the start of your residency is what they call a gap year or a year off. And to take this gap year is neither right nor wrong. It all depends on what are your personal preferences and current circumstances. Another reason that some people take the gap year is to do moonlighting to save up and prepare for exams abroad, such as the USMLE, the PLAB, or the AMC. And the rest goes straight into residency right after passing the board exam or the PLE, which leads us to part two. How to choose which residency to pursue. When you're deciding on which residency or category of specialty you want to go into, there are a few questions that you have to ask yourself to get a better sense of what you want. First one is, what clinical areas or organ systems are you interested in? For example, if you're fascinated with studying adult medical diseases like Dr. House, you can go with internal medicine or family medicine.
If it weren't for my obsessions, you wouldn't know that she has sarcoidosis.
And if you want anatomy and you're a fan of Dr. Sean Murphy, then you can go with surgery or orthopedics.
Incision should take place 2 ribs down.
But if you're fond with the inner workings of the brain, then you might go into neurology, neurosurgery, or psychiatry. The second question is, do you want to deal with patients directly? If your answer is no, then you can choose radiology or pathology, which don't include direct patient care. But if it's a yes, then you can go with medicine, pediatrics, or surgery, or basically any other category of specialty of medicine. And the third question is, what sort of work-life balance are you aiming for, or what kind of lifestyle do you want in the future? And can you imagine doing that for the rest of your life? Because, for example, when you go into surgical specialties, it would demand more work hours, less sleep, and a higher rate of burnout than non-surgical specialties. But of course, there are certain nuances to that. And finally, the last question you should be asking yourself when you've decided to do residency training is where? Because there's some differences between private and public hospital training. For example, in private hospitals, you will be dealing with mostly private patients with the constant guidance of your attending or consultants. While in public hospitals, you are given more independence in terms of managing your own charity patients. And on top of that, there's a higher volume of patients that are under your care at any one time if you're in a public hospital. You can also ask around or your seniors above you regarding which training institution has a better track record for a certain specialty. Because the better the track record, the better the quality of residency training. Now, it's important that you determine the answers to these questions because they will help you narrow down your choice in deciding for a residency. But remember that your choice or preference will change as you go through medical school, because as you're exposed in the clinic's rewards during clerkship and internship, you will come to realize and witness firsthand what it's like to be a resident or an attending in each particular specialty. If you like this video and you would like to know more tips about medical school, check out this playlist over here, which has all of the tips I have for studying in medical school. Thank you so much for watching, and do hit the subscribe button if you haven't already, and see you in the next video. Bye.